wasn't too bad of a week until it hit Friday, and my daughter Nikki had to refill one of her prescriptions for chronic pain. And this occurred before I talked to her, but she called the pharmacy. The pharmacy said, well, the insurance company won't accept it because it has to be pre-authorized. And this was a medication that was pre-authorized about 6 weeks prior. So this was a refill that needed to be pre-authorized. The pharmacy sent the necessary paperwork to the doctor's office. She called the doctor's office, and the doctor is on vacation until October 15th. Now, this particular drug is a drug that you're not supposed to be off from once you start taking it. So I found out about it a little after lunch, and I looked at Nikki and I said, you can't not have this prescription filled. She said, there's nothing I can do. I made the offhand comment, well, here we come, emergency room. And I was angry. I was paced. For those who have been over to my house, I was pacing. I was going a mile a minute up and down my driveway. My daughter got back on the telephone, and I was thinking of all kinds of things that I was going to say when I was going to confront the pharmacist. But as it turned out, she was able to get an emergency 10-day supply of the drug as long as she would pay for it at $78 for a 10-day supply. One of the reasons that she couldn't, neither one of us could have it filled and pay for it. One, because if you have it filled before it's pre-authorized, it's probably going to be 100% out of your own pocket. Two, the drug is probably around $300 for a month's supply of that particular drug. So anyway, they were going to fill it. While Nikki was doing her thing, I thought, I'll have the perfect opportunity to talk to the pharmacist, because every time you get a drug refill, they get it for you, and then they say, pharmacist. And the pharmacist comes up and asks if you got any questions. Normally it's no when you're off. And I said, just a minute, I do have a concern. I said, what is the impact on the patient who is taking Lyrica if they stop taking it cold turkey? And before I finished the sentence, the pharmacist was like this. And as I finished the sentence, he said, you should not stop taking it. I had to ask, well, what are the issues? The pharmacist said, well, the major concern is that you could experience convulsions. So, me and my wisdom, I always like to get little digs in here and there. And I kind of thought it out a little bit. I said, so you mean that if I had not shown up here with the money for this prescription for my daughter, that she could have a convulsion and die? And the pharmacist, that made her think a little bit. There was a little bit of a shock registering on her face. I don't think she has too many people asking her those questions. And she said, well, for those that are taking it because of, it is a seizure medication. So if you're taking it for seizures and you stop taking it, yes, you more than likely will have seizures. But it's also a possibility for those that are on it, that are being treated for chronic pain, to also have seizures. But she said one of the potential issues for people that are in chronic pain, using it for chronic pain, is that they may tend to feel kind of weird. That's a pretty good descriptor, isn't it? Weird. All I can surmise is that there's a possibility that you could have a psychological or emotional dysfunction if you stop taking that particular drug. Pharmacist went on to say that most people that are on that drug, the insurance companies will pre-authorize it for lifetime. But she said many companies now are only pre-authorizing it for a year. I looked at the pharmacist and said, this one was only pre-authorized for a month. Another shocked look came from her face, and she said, what? And I went on to say, how is my daughter supposed to know that this prescription has to be pre-authorized every month when she got a card with a prescription that said that you will only have to pay $25 a month for the next year for this drug? So it's pre-authorized 1 month, and you get a card along with it that says that you only have to pay $25 a month for a year. How is the patient supposed to know? The pharmacist was getting a little bit edgy by that time, so I was trying to back off a little bit, and she said, we don't know until we run it. We don't know either until we try to run the prescription. Later on that day, she got a call back from the doctor's office, had a conversation with the nurse, and the nurse basically said, I don't have enough time to do this. Well, first of all, she couldn't find the paperwork that came from the pharmacy. And when she found it, she had to give Nikki a lengthy explanation of why she couldn't find it, because it was on the wrong form. And then went on to say, I've only got 12 minutes left. And there's other patients to see. I'm not going to be able to get this done today. And she's going to be on vacation next week. So they're not going to be able to address it on the 15th, and we're going to be so busy on the 15th that we probably won't get it done then either. This is for a drug that has potentially life-threatening consequences if you don't take it. So the bottom line is, I'm going to have to probably come up with another $78 to do another 10-day emergency supply in order to get this drug pre-authorized through the insurance company.
So that's 6 months worth of pay for 20 days. Right?
Pretty much.
$25 a month.
Pretty much.
I feel very comfortable. It's happened to me this week too.
Oh.
And believe me, when I see my doctor, he's an earful.
Yeah, and it's just, this is happening to millions of Americans. It's just not an isolated case. I sometimes sit and listen to people telling stories like this, and I think, that just can't happen in America. That must be the outlier. That must be the thing that's happening just to a few people. But it's happening multiple numbers of times in our healthcare system in this country. Oh, and by the way, she still hasn't got a check from the temporary disability insurance company, and has to pay for drugs up front even though she's got insurance because of the pre-authorization issue. Oh, and by the way, ADP, the third-party administrator for the COBRA extension, see how complicated this is? I can't even say the COBRA extension of the healthcare. I haven't read the paperwork yet, but from what Nikki tells me, it looks like they may have sent the wrong paperwork completely initially, and they've sent other paperwork along that she now has to fill out, and I'm wondering what that's going to screw up. And also, one of the letters asked, did you die? Seriously? Are you still alive?
How high is the blood pressure? I'd be skyrocketed by now.
Are you done yet?
So, who's at fault? Is it the doctor? Is it the pharmacy?
All of the above. Except for patients.
I think from my experience, I'm gonna get political just for a little bit, and just by saying this, you might be able to tell where I'm coming from. And whoever wins this next election is going to preside over the death of between 72,000, forgot the number, 72,000 and 180,000 of preventable deaths in the next 4 years because of the healthcare system. Those are preventable deaths. I'm sure that that is not a legacy that anybody wants to be remembered by as an elected official. And I'm sure that it won't be found in any library that's built after their terms are finished. So, we'll do a little clip.
Oh.